Some strong methodology and like the rich research that you are doing here in the Philippines. So as mentioned yesterday in my keynote speech, you've seen all the data we've gathered, and a lot of it was from secondary data, but we're doing our own research also in UNICEF Philippines, and we've been trying to bring some of this key research across sectors to you today. We thought of bringing cutting-edge research, so you'll see some very interesting methodology, very interesting findings that illustrate the challenges and opportunities in advancing child rights. We gathered our colleagues and we did our own internal bit, like, you know, who wants to selection panel because we couldn't bring everyone. We had over 20 research submitted internally to come to present, and so we've selected the top 5. So wonderful for those that made it. And so I'm happy to bring, and we have some colleagues, but also some partners, researchers that have conducted this research. And we partner much more than we would hope to bring you. But all this research, as I mentioned yesterday, is on the situationofchildren.org/ph site. And then you can see the longitudinal cohort study that you've heard. We had Frank and others that presented yesterday, and other research. So, to start today, so you'll see we have research on, we'll be focusing on nutrition, water, sanitation and hygiene, education, and also child rights and business. So we've got 5 papers, so what we're going to do is that we're going to take the first 3 research to present, and we're going to take a break to have your questions fresh in your mind, and then we'll go for the next batch. So to start us off today, I would like to invite Dr. Marie-Christine Castro, who is the Executive Director of the Nutrition Center of the Philippines. Dr. Castro, so as mentioned yesterday in my presentation, nutrition is a key issue in the Philippines, and we know we've shown that food environment is crucial to address the problem of nutrition. So Dr. Castro will be presenting on children's lived environment, of the food, children's lived experience of the food environment, and it's about understanding how the environment is crucial to be able to understand nutrition around.
Thank you, Xavier, and good afternoon to everyone. I'd like to thank the organizers of this conference, Philippine Social Science Council and UNICEF Philippines, for the opportunity to present our study at this conference. Sorry, do I click or do I voice activate the slides? Voice activated, okay.
Next, please.
Yeah. Okay, thank you. So as Xavier mentioned, the title of our study is Children's Lived Experience of the Food Environment in the Philippines. And I'm presenting on behalf of our entire team, Ms. Fiona Watson and Ms. Corina Hawks, and Dr. Corina Hawks, who are consultants of UNICEF EPRO, the regional office, and UNICEF HQ in New York, respectively. And the team from the Nutrition Center of the Philippines consisted of Ms. Nika Oliver, Cherry Maramag, and myself, and Ms. Alice Coroy and Ms. Maria Evelyn Carpio were part of the team from UNICEF Philippines, from the nutrition section. Okay, so for the our study, I think, did I skip a slide? I skipped? Sorry. Balik. Yan. Yes. See John. So, I'll be presenting John. He's a 17-year-old from Godod, Zamboanga del Norte. Is anyone here from the Zamboanga Peninsula? Wala. So Godod is a 5th class municipality in Zamboanga del Norte. So the methodology, this was a qualitative study, and we had 105 respondents. We conducted individual in-depth interviews of mothers of children 6 months to 10 years old, and also of some adolescents 11 to 18 years old. The focus group discussions included around 64 adolescents 11 to 18 years old, and we also did some direct observation of children 5 to 10 years old. So we watched them on 2 days throughout the day, 1 weekday and 1 weekend. Can you see the pictures? They're still wearing face shields. So this was conducted, the data was collected in the first 6 months of 2021, during the time of the pandemic. Okay, so from the data that we collected, they were transcribed, and then we identified themes, including the main themes we saw were high or frequent consumption of soft drinks and instant food, lack of a varied diet, low food consumption. And then from the themes, so these are just examples of the themes, we identified what were the drivers of dietary intake. We included, knowledge, skills, income, assets, time, or convenience? Or was it the food, the product, characteristics, such as physical access, price, or promotion of the food products? And then we had an iterative process of drafting, discussing, and reviewing until we came up with a final report. So for the results and recommendations, I'll be presenting them all together. We're going through 1 day in the life of John in Godod, Zamboanga del Norte. So he usually wakes up. So the profile is already a composite of adolescents in Godod. Kasi nga we had a focus group discussion. So there were several respondents, but we came up with a composite profile. So John wakes up early in the morning to help his mother clean the house. Some of the adolescents also expressed that they had trouble sleeping during the pandemic because of their anxiety about their financial needs, whether they would be able to continue studying or not. So these were already these thoughts were already affecting some of the children at the time. And then for breakfast, after helping his mom clean the house, John would have breakfast. As you can see from the picture, they usually eat fried fish, rice, and vegetables. The usual fare, the usual staple in Mindanao, including Zamboanga del Norte, is corn. So he said that they only eat well-milled rice when they have enough money, because corn is more affordable for their family. In Godod, around 68% of the families live below poverty line. So after breakfast, John goes to his grandma's house. Since Godod is a small community, they have relatives who live nearby within the same purok. So on his way to his grandmother's house to help clean her house with some of his cousins, dun sila mag-meet with his cousins, he passes by a sari-sari store and sometimes buys biscuits, junk food, and soft drinks if he has the money to buy them. Okay. So you can see that the text in the white text on the black bar, that's also already a policy recommendation that because they are exposed, adolescents are exposed to advertising. He knows, they are aware that these food, such as chips, soda, are unhealthy, but they're tasty, affordable, and very accessible to them. So one of the recommendations is to support youth-led advocacy campaigns to improve food environments. So we have to design the advocacy campaigns from the point of view or perspective of the youth. And then after cleaning the house, on the picture on the left, He's with his cousins, they've already finished cleaning their grandmother's house. They spend their time using gadgets, watching some short video clips, scrolling social media. Of course, here also when they use their gadgets, they're also exposed to the advertisements of unhealthy foods. So they have an early lunch, since he had an early breakfast, they have an early lunch. So sometimes they go to his auntie's house, which is also nearby. If the auntie is there, she prepares fried fish that's brought from the mobile vendor with some vegetables from her farm. But the auntie is not always there. So if the adolescents, if the children are left on their own, they usually just cook instant noodles and sardines. That's their usual fare because they're cheap and easy to prepare. So this is also similar to the profile that we came up with of a younger adolescent in Valenzuela City. So when her parents are also out, either she cooks sardines and instant noodles or she buys hot dogs from the vendor. Okay. So one of the policy recommendations with regards to that's related to this is to introduce mandatory front-of-pack nutrition labeling on packaged foods. So there's some work that's being done at the moment in Congress and in the Senate to come up with front-of-pack labeling and to regulate the marketing of unhealthy foods to children. So after he has lunch, that's the time that John would sit down to do his studies. So in Dudon, their mode of learning during the COVID pandemic was modular. So the students would have to work on their assignments themselves. They expressed that they tried their best, but it's hard, and they usually end up wanting to nap. They usually want to give up, especially if they have difficulty with the topic that they're supposed to study. So when they give up, after a couple of hours, John went with his friends to the local town plaza. Because in their own village, in their puro, they have no basketball court. So they have to walk at least 30 minutes to an hour to get to the town plaza to play basketball. It was very also interesting because at this time, we contrasted the situation of the adolescents in Valenzuela City. And at that time, they were not yet allowed. Here in the NCR, the adolescents were not yet allowed to go out of their houses and play at this time. So this was actually an advantage for people in the provinces, for children in the provinces, because even during the pandemic, they were able to see their friends and socialize and play. And after they play, they usually take snacks around 3 p.m. The usual snacks that are available are juices, packed juices, and bread. So mga tinapay that's found in the sari-sari stores. So the policy recommendation that we identified from this is to protect and develop safe areas where children can play and do sports. So at home, they have dinner in the evening, again with dried fish, vegetables, and corn rice. Sometimes with instant noodles for dinner. If they're lucky, they could have chicken adobo with the chickens from their farm. So they don't buy the chickens, but they grow them and then they eat them when they're already adults. If you can see yung John, he's imagining some fruit, papaya, but it was too expensive and hard to find. So what we saw was that the supply chain and the infrastructure really affected the availability of fresh foods in the rural areas. So a policy recommendation is to improve roads in rural areas and establish supply chains for fresh food. Hopefully, the roads that are built, the farm-to-market roads that are built, do not meet the same fate as the flood control projects. And then after dinner, his mother lets him play games on her cell phone and watch TV. So while watching TV or playing with the gadgets, again he's exposed to some advertisements of unhealthy foods. And because the advertisements are very attractive to children, they're actually designed to to make children aspire to eat these foods. The adolescents that we interviewed also expressed that, oh, if I had money, I would like to buy that. I would like to buy fried chicken from Jollibee. So again, a policy recommendation related to this is to introduce mandatory legislation to restrict the marketing of unhealthy food to children. So, if we leverage on John's lived experience and translate it into policy solutions, ito yung main points. The complexity of the drivers of food choice requires solutions in different systems. So we saw the infrastructure, education, food environment, the food system itself. These are all outside the health system, but they also need to be, these also have to be addressed to improve the food environments of children. Secondly, major improvements in the built infrastructure system and food supply chain are needed to improve access to and availability of fresh produce, even in rural areas, which is actually strange because you'd expect to have the fresh produce in rural areas, but it's not always present. And as families continue to play an important role in the food choice, nutrition education should include parents and caregivers. So thank you from John and the whole team. And I put the link here for where you can access the whole report. Magandang hapon po sa lahat.
Thank you very much, Dr. Castro. So this first research shows us the importance of food environment, and I think there was a session later at the end of yesterday that discussed a lot of similar topics. The other thing for researchers that we want to highlight is that to make all research available for policymakers, we need to make it accessible. And storytelling, as demonstrated by Dr. Castro, is a great way to do it. And we want research that are about children, for children, with children. It's about telling the story of the child and their experience to be ingraining policy recommendation within that. So it's always a challenge as researchers how we communicate our research, and this is an example that we want to showcase on this really important topic. So thank you very much, Dr. Castro. The next presentation is another very interesting research that has been done. So, and I would like to invite Mr. Stephen Walker, Senior Manager, and Ms. Mia Jamo, Director of ID Insight in the Manila office, to present evidence that has been generated from a cluster of randomized trial on nudging hand washing among primary school students in the Philippines. This has been the work that has been going on for some time, and it's very interesting in terms of methodology and in terms of results as well. So, Mia, Stephen, over to you.
Thank you, Xavier. Today, we are very happy to present evidence from a study that we conducted with UNICEF on how easy, simple nudges can improve hand washing among Filipino students. This study shows how simple, low-cost, innovative behavior insight can help protect children's right to health and well-being. At ID Insight, we help leaders to design better policies, rigorously test what works, and scale what works well. And in this project, we had the privilege of working closely with UNICEF, who has showed strong commitment for translating evidence into policy and programs. Where? Oh, okay.
Stand over there.
Yeah, maybe I'll stand over here. Today we will cover intervention, our evaluation design, and findings around hand washing rates, availability of facilities, nudge implication, and finally implications for policies and practice. So hand washing is one of the easiest, cheapest, most effective ways of preventing disease. Yet, less than 10% of the children reported washing their hands at critical times, before eating and after toilet use. When we asked children why, knowledge was not the key barrier. They knew why hand washing matters, but they simply forgot or were in rush. So we asked, what if we redesign the environment so that hand washing becomes easier to remember and also more appealing? Hence, here comes the concept of nudge, the choice architecture that changes people's behavior in a predictable way. So it's simply making the good choice the most obvious and easy choice. So we use two types of nudges, a choice architecture, which changes the physical environment to make hand washing more obvious, harder to miss. And the visible signage is a physical cue that work on motivation and the memory. So this is the nudges that we installed at school. You can see that there are colorful footprints leading from the toilet to the sink, and there was also a poster showing the steps of hand washing. And then there was an arrow directly pointing at the soap, and this is an interesting one, eye. We also installed a sticker of watchful eyes, creating a sense of being observed. And there was also a soap dish, giving soap a dedicated and visible place. We will look into the evaluation design. We asked mainly 3 questions. Do the behavior nudges increase the rate of hand washing with soap after toilet use at school? And second, do they also increase students' access to hand washing facilities with soap? And third, were the nudges installed and working as intended? These 3 questions helped us not only to measure impact, but also to understand the practicality and sustainability of the intervention. And to rigorously measure impact, we conducted a cluster randomized control trial, what we often call RCT. In Zamboanga del Norte, 132 schools were randomly selected, 66 schools on treatment group, meaning they received nudges, and another 66 schools on control group who didn't receive nudges. And the nudges were installed in October 2019, and we collected data in February 2020, so 4 months. And the enumerators directly observed those changes in all 132 schools. I will pass it on to Stephen for findings.
Great, so we'll present the findings in the order of the 3 research questions that Mia presented just a moment ago. So first, on the impact of the nudges on hand washing, we did find a positive impact in treatment schools. For hand washing with soap, presented on the left, you can see that there was a 17 percentage point increase between treatment and control schools. It was even higher when we measured just whether or not they were washing their hands with water alone, of 25.6 percentage points. We also broke this down to look at differences across subgroups. So first we looked across grade levels to see if older students or younger students had any differences in their rates of hand washing, and we found no. So on the left we present younger students in grades 1 to 3, and on the right it's older students in grades 4 to 6. and improvements in hand washing were the same for both of them, which is a good sign. It means that the experiences of older and younger students are relatively the same. We also looked at gender. I'm sorry, the graph isn't showing up here, but the same thing here. We looked at differences for boys and for girls, and the findings were the same. There was no statistically significant differences across boys and girls for the change in hand washing rates. Moving into the second question on the availability of facilities, oh no. Okay, well, in sum, we found that nudges increase students' access to functional facilities near toilets. Specifically on the right, we found that in the treatment schools, they did, at the end-line data collection, have higher access to functional hand washing facilities with soap, which I will explain, hopefully it's there. Oh no, on the second graph. No worries, I'll talk through this also. So the increase in facilities access was driven by higher stored water availability. So what this means is that between control schools and treatment schools, for the schools that had stored water, so not like piped faucets, but more manual containers that were refilled, those schools had higher access to hand washing facilities at endline. The reason being is that in addition to increased behavior change of hand washing through the nudges, it also encouraged teachers and other school staff to help ensure that materials were available to students to wash hands. Compared to in schools that, for example, just had functional faucets, there are other infrastructure and other challenges there that led to no statistically significant differences across schools. Lastly, for nudge implementation, we looked at some process-related elements. Oh no, it's okay. I can talk. I can talk. Oh, great. Okay. So at Endline, this was 4 months after the nudges were installed. So the posters, the eyes, etc. We also made sure to see whether or not those nudges were still in place, and we found that for most schools, they were still present. With the exception of the poster, there were some that had degraded over time, but for the most part, all of the nudges were still in schools. And all of them remained in good condition, again, except in some schools for the footprints. These are some examples of the condition of the nudges at the 4-month period. So we consider them in bad condition if they were no longer able to fully be used. So you can see for the footprints that are rated fair, you can still see them, that they somewhat degrade over time. And same thing with the posters. They get dirty, they can fall off the wall, etc. We followed up the data collection with a number of qualitative interviews as well to ask students and teachers what their experiences were of the nudges. And overall, the responses were quite positive. Both students and teachers approved of them and believed that they contributed towards school improvements that benefited students. So they were quite happy to have them in the school. We also asked for some feedback as well about if there are any improvements that they would recommend if these nudges were to be used in the future. And they did give us some helpful feedback. So for a lot of them, they recommended using different paint or different colors. For the printed materials, for example, they recommended laminating them so that they're more durable and will last over a longer period of time. The last slide here is just to mention the cost. So one of the largest benefits of this intervention is just how cost-effective it is to do. So for all of the interventions compiled, the total cost was around 3,400 pesos. And we expect that these will need to be touched up or updated maybe every 6 months. But still, for the increase in hand washing of roughly 17 percentage points and how low cost these nudges are, we consider it to be a solid investment. Okay.
So to summarize, the nudges helped improve the school hand washing with soap rate by 17 percentage points. And then they also increase access to functional facilities with soap by 20%, meaning, as Stephen mentioned, they brought behavioral changes beyond the hand washing itself. And the effects lasted about over 4 months. The nudges were low cost, scalable, and also very well received by educators and students. So we have some recommendations. Maybe, how can I go back? Oh, I think they also disappeared. We have also different set of recommendations, but it is important to note that the nudges don't replace infrastructure. They work best as complement when the basic conditions are met. Those conditions include reasonable ratio pupil to toilet ratio, as well as availability of functioning hand washing station as well. So based on this research, we came up with 3 key recommendations. The first one is that the nudge interventions to be scaled as part of a holistic package that include other programs to improve wash knowledge and infrastructure at schools. Meaning, don't isolate, but embed them, integrate them. And secondly, we recommend the nudges to be adapted to fit local context while retaining those tested designs. And the third, this was a recommendation during the pandemic time, so we recommended that nudges to be included in the school improvement plans as well as a COVID response. Thank you very much for listening.
Thank you, Mia and Stephen, and apologies for the technical issues. It's always different screen, different technology, as always. A very interesting presentation here where we introduce an interesting intervention, which is nudges, and which is the experience of understanding the experience of children's life, like their environment, and like how we incentivize change of behavior. But also methodologically, in terms of a research, a randomized control trial, we know that these are very the gold standard when we can do it, and how it just really demonstrates the impact of an intervention. So moving on to the third presentation, which is different, this one. UNICEF has been working more and more, and we know the importance of the private sector in the realization of child rights. And UNICEF, in our country program, we are focusing also on, in a country like the Philippines, where there is a growing private sector and influential, how do we work on child rights and business? And that's the topic of the next presentation. So my colleague Ernesto Castille, or Nonoi, will be discussing why children matter in the sustainability reports of publicly listed companies. His presentation underscores the role of the private sector in advancing child rights for sustainable development. So over to you, Nonoi.
Thank you, Xavier. To those who have seen me in the concert last night, so this is a very different Nonoi this afternoon. Yeah. Okay. There you go. So yesterday we had a privilege of listening to one panel session that talks about the link of social science research to industry development. If you remember the shoe industry yesterday, the flower farms, and then the urban gardening in Baguio. And earlier this afternoon, there was a mention about thought-off labeling packaging for nutrition products and even wash facilities. These are all linked to efforts of the private sector. So the question really is, where is social science in the social science research in the spectrum of understanding private sector relationships? So this afternoon, give me your time in terms of linking social science and then private sector initiative through the UN Guiding Principles for Business and Human Rights, which was launched in 2012, and then the Children's and Business Principles. To know more about the Children's and Business Principles, you would see there the 10 principles. Look at the QR code, and there are tools there that's very relevant for the discussion this afternoon. Because we need to storify the child in the context of where's next here? Yeah, there you go. Right, picture this one. So Nene is a young girl from Mindanao. She lives in the middle of a palm oil plantation industry where the very, very big private company owning palm oil is basically there. This is fictional, not real. So she lives in a house located in the middle of this industry, bordering two different regions. Her parents are palm tree farmers working for a middleman that delivers these palm tree fruits to a nearby milling station. Her younger brother, 11, and older brother, 15, help her parents in harvesting palm tree fruits. Her school is a 4-kilometer walk, and the nearest barangay health center is also around 4 kilometers. The river near them usually overflows with flood during rainy season. They could not grow vegetables because of the pesticides and insecticides used in the palm oil industries. So we look at this one in the context of what are basically the child rights deprivations based on the story of Nene. And that's your 30 seconds to look at. Having said that, we did dive into, maybe let's look at one aspect of the whole spectrum of child rights in business, and really look into the largest of the companies in the Philippines called publicly listed companies. There are almost 300 of them. So in late of 2024, we reviewed 86 of the PLC's report submitted to the Securities and Exchange Commission into the Philippines Tax Exchange. And we developed a study called Investing the Future, Why Do Children Matter in the PLC reports, the sustainability reports of the public listed companies. I've mentioned the objective really of the study is to look at and establish evidence on how children's rights are reflected in the sustainability reports, and of course the integration of children's rights into business policies, legislation, and responsible business conduct. If you are familiar with ESG reports for companies, this basically environment, social, and then governance reporting mechanisms. Well, it looks like basically financial in nature. The dual materiality of these reports really looks at into what we call the social aspect of the ESG mechanisms. I had talked with some of our colleagues here yesterday. We talked about, maybe reflect about what we call social return of investment and social cost of investment. The definition of the UN Guiding Principles for Business and Human Rights and CRPP says that the government is duty bound to protect children's rights. The private sector is duty bound to respect children's rights, but both government and private sector basically has the role to provide judicial and non-judicial remedies for children. And this is basically to also look at that, children are everywhere in business. So children is either, number one, they are consumers of products and services. Number two, they can also be workers because of the young work and mechanism. Of course, we don't want child labor in the space. They're also present in the workplaces through their guardians and parents, and they're also basically also part of the community affected by impact of businesses. A little bit of disclaimer, when you see sample of companies being shown on the screen later, this does not necessarily mean that UNICEF endorsed them. This is just basically recognizing that they're doing something in the space of sustainability reporting in the country. This is basically our methodology that I already mentioned earlier, 30% of the entire PLCs in the country, and also deep dive into all of the 10 principles of child rights in business, and then we look at basically what we call the due diligence mechanism for child rights in the private sector. We rated them whether they literally explicitly mention children and children's rights and their mechanisms for sustainability, whether it's implicit or there's no evidence at all that mentions that. This is basically qualitative and deep dive review of the process, a very, very first in the country. That's why this is also an opportunity to look at social scientists and social researchers looking into the economic blend and the social blend of environment, social, and governance pillars in the sustainability mechanisms of the private sector. Just note, corporate social responsibility is yes linked to corporate sustainability, but it doesn't mean they are basically corporate sustainability. Industry profile, we look at 60% of what we call EVGD, or economic value generated of the companies, and also looking into this profile now. And it's a little bit biased into looking into what's basically the government priority industry mechanisms for the years. That's your tech, transport, construction, etc. Around 8 of them. And also looking into what's basically what we call the high risk for children in terms of business relationships. Here are the main 5 results of the study. First, it says children's rights are rarely explicitly addressed in corporate sustainability reports. The reason being is because oftentimes when you talk to businesses, they will say there's no financial materiality for children in the company. And they would say, children is not our direct consumer for these products and services. So that's basically one of those. The other one would be that there's positive effort that exists, especially that's linked to the UN SDGs, and oftentimes linked to CSRs. But again, CSRs are, yes, linked to corporate sustainability, but that doesn't necessarily mean they are sustainability as a whole. The third one is basically the most common thinking about when you look at child rights in the business, and everything that's child labor. But CRBP is beyond child labor. Yes, principle number 2 of the principle of CRBP is child labor, but you look at markets, security, environmental protection, climate impact, marketing, labeling, etc., and workplaces mechanisms. Fourth is that companies are more likely to see their children's rights when they are basically directly impacted based on their sustainability mechanisms. Having said that, these are basically the summary of what we call in terms of the foundations of principle number 1. If you see greens there, there's basically no evidence at all showing that space. The other one was also looking into child rights that are being really showing up in company commitments, like is there a stakeholders mechanism to engage children for example, development of gaming now for children. Basically, the children are basically rarely consulted in the process. The other one was also basically about real lack of focus on child as risk and materiality assessments, because companies will say this is immaterial for us, but in the context of global materiality, then that's happens in terms of social return of investment. A few weeks ago, I was part of the team that reviews Department Order 149, which look at the hazardous work for children in the workplaces. So these are a basic example of that. Positive efforts are basically in the context of child labor compliance, but within the large company, yes, but within the supply and the value chain, no. For example, one of the biggest pineapple industry in the country is zero child labor at the main company, but the farming mechanism is a different story. Same with coffee and other products. This is basically the favorite of everyone on SDG reporting. Everybody reports on SDG in a way, but basically still around 12% with no direct evidence that connects SDGs and children's rights. CSR program is the most favorite, but sometimes there are disconnect on CSR programs. Like your company is working on electricity, and then the CSR program is giving school supplies. Corporate sustainability would mean the link of your products and services to your sustainability. I mean, nothing is wrong with that, but the link should have to be seen. Again, a little bit of disclaimer. These are good examples that we've seen on the ground now. And then basically, this is also the context of child labor we already talked about. And then, but there's basically limited disclosure for security arrangements for children. Security doesn't mean only security in the context of quote-unquote security in the layman's term, but this is basically safety and welfare of children for exposures to products, risk, and services and approaches. And then there's the role we mentioned about looking into where is children in the context of land acquisition. This is basically displacement to health, displacement to education because of a big company being created or established in the area. This one really focuses on what we call children as direct or indirect consumers of products and services. And my favorite is obviously technology, where children will have now cell phones, etc. There's a battle between legal in terms of compliance and product manufacturing in terms of design. So that's what we see now in terms of these exposures to children being direct or indirect consumers of products and services. This one is safety, that I already mentioned a lot earlier. And this is basically regulatory standards. Our concerns with regulatory standards now is linked to financing. For example, we have a battle between when the financing for children that leads to psych, or basically buying online products and services that doesn't there's a long, broad line in terms of this one. Having said that, 1 minute, yeah. I'd like to deep dive to the recommendation I have for the social scientists, because this is your space this afternoon. So there are lots of tools that with regards to child rights in business. We'd like you to look into deep dive into economics, social dividends, and social impact, and ESG. We look into certain examples. So one would be, there's a tool that we call Child Rights Impact Assessment. You can look at whether that would be your industry in your LGUs, or that would be individual company. We also to look at review of policies and programs that links to social return of investment, and research on emerging innovative industries like ICT, digital, and creative industry in general. And of course, to look at what we call the mandatory human rights due diligence in the context of the implementation of the UN guiding principles for business and human rights. To know about the basic specific methodologies and tools that links social science and private sector mechanism, this is the QR code for this one. Maraming salamat po, and magandang hapon sa atin lahat.
Thank you, no, and you can stay on the stage because we. So, a third very interesting presentation on a challenging topic. We know that we have some study on the food industry impact on children, but the broad issue of private sector impact on children, both positive or negative, is an area that is challenging where we get the data, so like through publicly listed companies, like their report, how they report on it, and with the type of impact, as we saw, like, child labor might be a direct one that we can think of, but there are other impacts that that companies have, so a very interesting research. So we'll take a break now to discuss and to have the question and answers. So Dr. Castro, Mia, Stephen, if you may come here. And I would like to open the floor for questions to our three presenters, our three papers. Please, there's a microphone, so there's 2 microphones, if you may use that one. Go ahead, if you may introduce yourself and have a question.
Check, okay. Good afternoon, I'm Joe Po from CBD Car in Baguio. To our friends from ID Insight, a very interesting behavior change communication study. We're very much in the program of advocacy for our programs and services related to adults and health and development. And one of our major concerns is that even if we do build in-school teen centers or community teen centers to promote sexuality and reproductive health services, you cannot ensure that the teenagers will come. That's one of the problems that we have. So in your study, age was not a factor for them to participate in hand washing. Also, awareness was not the issue. It's more of their behavior towards hand washing, their practice of hand washing. So in your study, I would like to ask, how did you decide in the visuals that you would use? Did you do testing with the kids on what would be familiar or at least effective for them?
Thank you for this question.
Thank you for the great question. Maybe I can take this one. So we did a series of global best practice. So we did a literature review to try to understand what works best in similar contexts. So we took examples of those nudges are proven to be effective in different countries, including the States, Thailand, India. So we took what we think is the best package, but also we wanted to make sure that it is locally contextualized. So we brought it to the schools and we observed how children are using those toilet and hand washing facility. For instance, footprint was not in the initial package, but when we went to the school, we realized, okay, the toilet is at one corner, and sometimes hand washing facilities on another corner, so children have to walk through the hand washing facility, and the area is crowded. It's often called the health corner of the classroom that they use for washing dishes, doing a lot of things. So we wanted to create a pathway to make it very visible and appealing for the student. So based on the global best practices, combined with what is needed on the ground, and we came up with this five designs.
And just a follow-up, because we're working in a closed area like at school, how far away from the facility or the hand washing facility did you start making these nudges so that they'll be more effective for the children to basically follow these nudges?
Great question. So we came up with eligibility criteria. So we excluded the schools that had hand washing facilities that are too far away from the toilet, because we thought, again, because nudges don't really replace the infrastructure. So those basic conditions include, the reasonable distance between the facilities, hand washing facilities, to the toilet. Did I answer your question?
Yeah, but did you have like maybe a summary of like what's most effective distance to start the nudges, at least in general with the outputs that you had?
Yeah, I think that was not really the scope of our study. Our study was conducted in the schools that had just a reasonable distance, which means that the hand washing facility was within the classroom or a reasonable distance from the toilet.
So it was just based on the selection criteria that you made?
Yeah, and already all the 132 schools that were selected met the criteria, so there was no difference between those schools that were assessed.
Okay. I just want to say that because we really need to bring children into our service facilities. And like you said, awareness level is not really that problem. These are all taught in school. The services are supposed to be available. We work with a lot of partners, but most of the time the children just don't go and avail of these services. So this is an interesting study. I would like to get a copy of the study to look at it and maybe impact our own advocacy work when it comes to ASRH. So thank you.
Thank you for your question.
Good afternoon, I'm Ana Juliana from PSSC, PCR and Network Officer. So thank you very much to our presenters. They're very thought-provoking presentations. First, on the nutrition study, I think it's very concrete how the stories led to some, concrete policy actions. But I'm wondering whether in the supply chain you also included, Doctor, the advertising sector there, because I think that they have a big role here in improving food environments, as the children said. This is more tasty, etc., etc. I don't know if it's very hard to work with the advertising part of the supply chain. And also, I was wondering if economic initiatives were made available or were recommended as an important component of this, improving food environments. Okay, so for the hand washing, very, very concrete results and very, very interesting actions, evidence that were shown. Thank you very much for that. I was wondering if, I don't know if it's part of your study, but this is very concrete behavior change through the nudges. Okay, if this do we assume that this positive behavior of hand washing also translated to this behavior at home? If children, there are no nudges at home, but I would think that, because they have been used to it, they saw the importance, they were nudges to really motivate them, and they carry that positive behavior at home. Okay, so, but and the last question on this is you have given positive, very good policy recommendations. I'm wondering whether there is a follow-up, with whoever, Department of Education or whoever would be concerned, because UNICEF really made a good, motivated us to really not just to look at evidence, but to really ensure that what we're finding out translates to certain actions and policies and program improvement. The last point, private sector, no. It's very, this is very complex, like talking to private sector. But this is just a question in my mind, no. Because you look at only at 30 publicly listed companies, I was wondering if there is a connection of the informal private sector to the big companies, because we know that the informal sector is where you have grave violations of child rights too, for many reasons. So is there can you show a supply chains linking, I don't know, global, etc. in the business continuum? And this is just a thought that came to me about really making or motivating business schools, business schools to really include child rights agenda, or because that's part of really incorporating an education on this important topic as the entrepreneurs, future entrepreneurs, or those who will be working businesses start their business. Thank you very much.
Thank you for this really good question.
Yes, I'll take the first two. Thank you, ma'am, for your questions. With regards to advertising, yes, this is really a big problem. So that's why it will really require legislation to address this. Work is being done, and some of it is also being supported by UNICEF, to draw up legislation to restrict the marketing especially of food companies, of unhealthy foods towards children. And there's another set of bills working on the front of pack labeling. So there are different types of front of pack labeling. There's the warning label, so that you'll see right away if it's high in trans fat, high in sugar, high in salt, sodium or salt. And there's also a traffic light signal, which is red, orange, or yellow, and green. So but these front of pack labels will still depend on technical work that's still being done by the DOSTF and RI on the nutrient profile model. That will be the basis of the legislation. So we have to work both at the national level for legislation, and there are some LGUs who have ordinances then for regulating marketing towards children. The second question po, yes, we agree po. You mentioned incentives, but I think you're also referring more to subsidies for healthier food to make it more affordable to children and poor families.
Anything on economic empowerment?
Okay. That will also involve some economic interventions like livelihood and improving the economy po. Yes, but that improving the supply side is also, the situation of the supply side is also something that we need to work on. Thank you po.
If it's okay at 1 minute, because that's very linked to CRB. If you look at advertising, marketing, and responsible business conduct, we had two very, very good research that came a few months ago. One is online buying for young Filipinos na bumibili sa Foodpanda and Grab Food. So the main bulk of online buying in the context of advertising and marketing is also in the context of what we call premium trade promotion. Ibig sabihin, di ba, yung mga na-advertise doon, mga big companies that can really pay premium site in the online platform. That is very the same to trade promotion in supermarkets. Kung napapansin nyo, pagpasok nyo na malalaking supermarket, what you can see are big brands. But these big brands may not be necessarily be healthy brands. What we're trying to do now is to influence our duty bearers in government to look at responsible trade promotion both online and on the market sector. We're hoping to get one of the biggest markets in the Philippines. I could not mention it because there's a very, very strict study and pilot. But if you are going to see that in the future, then you would remember us perhaps. So that's what. Then I'll respond later on the private sector work after.
Thank you for your question. So starting with the first question on whether or not the nudges might have influenced hand washing behavior at home, We can't say for sure. It's a bit tricky because nudges are very environment specific. So increases in hand washing are very directly related to the pathways that were on the floor and the other materials that children were exposed to. So it's hard to say at a home environment where they don't have those same behavioral cues that they would have increased hand washing rates at home. It's possible, but it may be dependent on a lot of other home-related factors that are outside of our control or our oversight. So it would need a bit of further study to see if there's some carryover. Yeah. For your second question on scaling this up and where things are going next, so based on the results of the study, the Department of Health released a playbook for LGUs on hand washing that included instructions and guidelines for implementing behavioral nudges in schools in any LGU in the Philippines. So all LGUs have access to these materials through the Department of Health. We don't have any immediate knowledge about to the extent that those have been used, but they have been disseminated.
Okay, but the question of the link of the PLCs to the supply value chain into the informal sector. So we started 86 of the company of the 200 plus, that's 30%. And what's being revealed there is the human rights due diligence mechanism doesn't necessarily translate down to the lowest of the supply in the value chain, which Professor mentioned something about the informal sector. So what's happening now in the formal sector? So two things. One is, in the context of investment in duty bearer principle, there's a push to look at whether or not government can provide social protection mechanisms for the informal sector, whether we could provide decent jobs, decent skills upskilling mechanism for the informal sector, so that we'll be able to provide what we call minimum standards for family-friendly policies and family welfare program. I would not be able to expound it here, but if you guys is interested to understand family welfare program and FLPs, Google it. It's a mechanism to support as well our informal sector. The third one is in the context of incentives and investment. For example, the Philippine government has a law called Barangay Micro Basic Enterprise Law that provides so much incentive for micro-entrepreneurs so that they're going to be exempted to taxes, etc., etc. And supposedly the income for that goes to social pension, social protection, and social insurance. But that needs a lot of advocacy work, right? For example, SSS has a program called Alcansya Program for the transportation sector. But advocacy to work to the Alcansya program, to the transport sector, really has to go to the grassroots level. The last point is on the link of the business schools to ESG and sustainability. I think I can mention this one because you can actually look at this one in the website. Ateneo has an Ateneo Human Rights Center. They work on child rights and business and human rights. And they also have their own corporate sustainability mechanism. Then you have the Lasal as well and the economics department of UP Diliman. So these are examples of what's happening in the space now. But the need to kind of like really this within the schools themselves we talk together for CSO.
Thank you, Nonoy, Dr. Castro. Any other questions? Please don't. Maybe I would have a question. We heard from the session before from the children themselves that doing research with children to engage them is crucial. To what extent you engage children within your research and what kind of ethical challenges you may have faced in your research?
Thank you for the question. As you saw from what we shared, we really involved them because we look at their lived experiences. Ideally, we would also involve them in the design of the study, but the COVID restrictions in place at the time did not allow us actually to involve them in the first step of the research. And also, after the data is already collected and analyzed, children would also have a role in validating there are also some steps in the data analysis that children can participate in.
No?
For this specific study, not really because it's a deep dive just review, but I'd like to mention one principle. The principle of ESG governance mentions that children shall be consulted when the company develops its own product and services. And we are seeing into two biggest of the public listed company in the country. So one is PLDT Smart. I think they are going to, I know, we work together in having their child's impact assessment as well as child safeguarding policy, and children are basically involved in that space. The other one is Metro Pacific Tollways Corporation, which is even goes beyond the road safety program of the entire Philippine government with DepEd, etc. So these are very, very good, massive example of investing in children's rights in the context of products and services of the companies.
Yeah, for our hand washing study, we really simplified the process to make to make it concise. But it was actually a very iterative process. So the first impact evaluation we did was to understand the rate of an impact of hand washing after the DepEd and UNICEF-led wash campaign called High Five. So before the campaign, only 2.2% of children were washing their hands. So basically no one was washing their hands. So High Five campaign had a moderate success. So, but still the hand washing rate was below 10%. So it made changes, but not significant enough. So that's when we had a consultation with children, actually trying to understand what is the reason behind. And through that, we understood that knowledge was not the barrier. While information campaign is useful, you would never solve that issue because that has never been the main issue anyway. And children said they mainly forgot to do it or they were in a hurry. So based on this element, they're just forgetful on this and it's not their priority. We came up with a nudge design. So this was based purely on the results of the consultation with children. I think we have to wrap up here.
So for the RCT, the way that we collected data from this, it was largely observational data, so it didn't necessarily require a lot of immediate interaction with any stakeholders. The way that we collected data to measure hand washing was by having an enumerator, a data collector, go to a school and sit either in the back of a classroom or somewhere near where the toilets and the hand washing stations were. They would stay there for a period of hours and just on a piece of paper observe and count the number of students that are going to and from the bathroom and record whether or not they were washing their hands, so purely observational. That was enough for us to detect differences in impact, but we did decide to add the qualitative interviews on top of that, both with teachers and with students, because it's not enough just to see whether or not they worked, but it's important for us to understand why. So we did conduct those key informant interviews with some of the students to understand, what do you think about the nudges? What have your experiences been? Do you think these are useful, etc. So for us, they're an important mechanism to help us understand if this is working, why.
Thank you. So a big round of applause for our three set of presenters. An interesting research. Thank you, Dr. Castro, Noloy, Mia, and Stephen. How are we doing? We have two more presentations for this session. Do you want to stand up and stretch for 2 seconds? I think it's like boost, lunge, it's always a bit of a challenge. Anyone wants to stretch? Stand up for a second. Everyone stand up. Everyone stand up. And stretch. Okay, good. And we stretch our legs too. Stretching your legs. Okay. Good. So we have two more very interesting research, and two of my colleagues are here today. So in the second batch, for the first presentation, we have Mr. Nicky Tenasas our education colleague, who's going to come to share a very interesting research about the impact of COVID-19 on learning across different subpopulations of the Philippines. We know that COVID had a huge impact on all of us, and especially children, and on children learning. So one of the things that we were looking at as UNICEF is what's the learning loss? How much children have lost of learning and the catching up? So that's been the subject of that analysis, and I'll hand over to Nikki to share this.
Thank you, Sabi. May I have the... Where is it? Yeah. Okay. Okay. So, good afternoon. Hi. Hello. Okay. Let me destroy your afternoon. Kasi the results are not so good. But the study we conducted, we did it with a very credible or a very famous research firm, the Australian Council for Education Research, based in Australia, and it was an offshoot of a previous study that we did before the pandemic. Okay, so let me give you the background. So these are the research questions. We all went through the pandemic. Everybody at that time was calling it the new normal, but I think we're back to the real normal. I think we're not doing the same protocols anymore. We're not being as cautious. So that wasn't the real new normal, no? So we're back to the real normal. But these are the what you call this, the survey questions. These are our research questions. We wanted to find out how much was lost during the pandemic. You can imagine if you had relatives or kids or grandkids at that time, they were having trouble with their educational experiences. No? So let me give you a rundown of the results of that period. Okay, so methodology first. We conducted the UNICEF, the early childhood to kindergarten to grade 4 longitudinal study. So in that study, we collected data from over 3,000 kids, and we followed them over a series of years. So you would see here, since the start of kindergarten, we followed them until the end of grade 4. So this is the first main message. This one was done before the pandemic, and already it showed yung learning crisis, even without the pandemic. Okay, so that's the first message that I wanna give. But we realized that when the pandemic struck, we can use that data set with a series of statistical flexibility and mind-bending to give you a picture of what happened during COVID as well. Okay, so methodology. From that data, we wanted to make sure that we were getting, essentially we are having a different perspective on the data because the first collection of the data was a different purpose, and then this time we're going to use it for the pandemic, right? So we want to make sure that we're doing something right, and when we release the results, that it's really comparable and it's really representative of the thing. Also, later if you want some details on the methodology, we can discuss. But I feel that the results would be more interesting. Okay. Just one last thing before we go is that it's very important for all researchers. I see a lot of young people here. When you present your research, make sure you present the limitations. At the beginning, you might say that this is this is limited by so and so. But then at the end, when you give your recommendations, many people, they generalize for everyone. Ganyan. So the problem is, you forget what your sampling was for, what your methodology was for. You need to make sure that it's really for that specific purpose. When you claim something and when you recommend something. Okay, next. So let me help you understand the graph. The green line shows you, teka, alis ako. The green line shows you the results before the pandemic. Even without COVID, what do you see? Grade 4 students are graduating grade 4 with only grade 3 competencies. Before the pandemic, again, before the pandemic. And it's even worse in BARM. So the orange one is in BARM. You need to understand that BARM has a special place for UNICEF. We even have a dedicated office for that one because a lot of the deprivations in the child's rights are really in BARM now. So we have dedicated personnel in BARM. But for the orange line, compare the orange line with the green line. Even without the pandemic, BARM is faring a lot worse. Okay? They're graduating with grade 1 or beginning of grade 2 competencies by the end of grade 4. Now, COVID happened. If the child started education when COVID started, so kinder when it was the pandemic, we can expect that. Look at the what's it? Violet, the violet one. You can expect them to not even reach grade 3 competencies by the end of grade 4 because of the pandemic. So status quo. We are already losing one whole school year without the pandemic. And then the pandemic added another school year of lost learning to someone who started schooling during the pandemic. Can you imagine being kinder at the time when you had to socialize, you had to learn the letters, and you had to start your fine motor skills, you had to hold the pencil and whatever. You're doing it online, or you're not doing it, or you're just at home, right? So that's the situation. So, and then lastly for BARM, of course, they're staying at kindergarten level by the end of grade 4. Okay, so summary of that is this one. So that's the second message. The pandemic really set us back at least one more academic year. You can just imagine if we extend that graph to grade 5, grade 6, grade 7, how it will dip and how far away we are from learning grade 12 competencies by the time you graduate. Maybe you just reach what? Grade 7 competencies? You don't know. Huh? That's a different study altogether. Similarly for math, the results are the same. So that's the main finding for mathematics. In the past, we were reaching up to grade 3 when there was no COVID yet. But with COVID, the purple line, we're just one academic year below. But it means 2 academic years below standard. When you should be learning grade 4 competencies, you're still at grade 2 competencies. Okay. So this led us really to sound the alarm bells in terms of the learning crisis and things like this, no? So this is the summary for mathematics. You can, I think you will get a copy of this one. Just to highlight the importance of kindergarten. Key point number 3, soundbite levels. Even if the kindergarten is so bad quality, it's still better to go than to not go. Still better to go. Even if you say that the kindergarten, the daycare center, no, this is not kindergarten, sorry. I'm talking about early childhood, daycare, sorry. Daycare and child development center. Even if the child development center looks really bad, the teacher is not so good, it's still better to bring them there than to keep them at home. That's a soundbite that you can take away from this one. So the idea is really to improve our early childhood education, because you can see a significant difference in the performance during COVID, right? So this is the summary. And then lastly, in terms of socioeconomic factors, this is no surprise. The ones who are a bit well-resourced perform better because they have resources at home, they have a support structure, they perform better. The ones with low economic status, even before they get to kindergarten, they have experienced multiple disadvantages and multiple problems in their life. Maybe when they get there, they're already stunted. When they get there, they have already been abused. So it comes with the concept of being in a lower economic status, right? So the point really is, what can the education system do so that these disadvantaged kids can catch up? Because currently the system just gives you the information, gives you the education at the same pace. If you came in disadvantaged, by the end you will still be disadvantaged. If you came in with an advantage, you will graduate with an advantage. It's the same. But the disadvantage will never catch up to the ones who started out with advantages. Okay, so the question is, what do we do inside these 12 to 13 years? What can we do so that the disadvantage can catch up? And then lastly, in terms of, this is the last slide. So just in terms of recommendation, number one recommendation is that we need catch-up programs. So in the past couple of years, we have been advocating for catch-up programs and then concepts of teaching at the right level. And one of the results of that advocacy was the ARAL law, which now institutionalizes learning recovery concepts in different modalities. Number two, what do we do? In our own fundraising activities, in our own project proposals to different funders, we prioritize the ones in grade 4, grade 5, grade 6. So that those kids who started their learning during the pandemic, we can still catch them before they graduate grade 6. For many of them, grade 6 is the last level they will have in education. So our projects model interventions that really try to catch them before they leave the system. And then lastly, it's very important to have continuous assessment so that we know the progress. And one thing that we always follow is that if you want to measure change, do not change the measure. So what we're doing is we're using international standards. Those are the, if I can go back. If you see the levels at the left, that one is coded or equivalent to PISA and CPLM levels. So that we know where we are even in an international scale. So happy to answer questions later on those key findings. Thank you.
Thank you very much, Nikki. A very interesting research, and this is taking advantage of research that was already conducted. Remember yesterday when I presented the data on education and the importance, the longitudinal cohort study that we've done to indicate the importance of early childhood and its impact on children at like grade 5 performance. That's a study that was used and the findings were used to come up with this study. So repurposing some of the research and expanding it to understand the impact of COVID. And very worrying results and how do we catch up. So thank you very much, Nikki. The last presentation is another one on nutrition and a very interesting one. This is part of one of the biggest research we're doing at the moment for UNICEF. The government has the Philippine Multi-Sectoral Nutrition Project, which is projects that emanated to some work we've done in the past, and it's $178 million project in 235 municipalities. Bing will let you know more about this, but we're working with DOH to do an impact evaluation of this program. 235 municipalities is a big scale for us. Imagine data collection. We're not doing, of course, we're doing a sampling of this, but this, we are in the middle of, we're about to conduct the midline assessment, and Bing will present us the research from the baseline. So there's a baseline, midline, and endline research. Dr. Castro was involved and NCP was involved in the landscape analysis, and another big piece that if you want to know more, take advantage of Dr. Castro. A lot of research, we collaborated on that one as well. So I'll hand over to Vilma Aki. Over to you, please.
Thank you, Xavier. Magandang hapon sa ating lahat. Naimbag mamadam ka tayo amin ako. Ay, walang nakaka-relate sa akin, pero good afternoon. So, as mentioned by Xavier, I will be sharing this afternoon the findings from the baseline evaluation of the Philippine Multi-Sectoral Nutrition Project. So, this evaluation, it is actually more of an impact evaluation, was commissioned by the Department of Health and is being conducted by UNICEF and its contractor, the American Institute for Research. So, just to provide a brief background, we know that malnutrition among children in the Philippines is still high. So, recent survey, 2023 NNS showed that stunting, yun po yung short for age, bansot or kulang sa tangkad. So, stunting continues to affect 2 in every 10 Filipino children under 5 years old. So, 23.6%. Per WHO standard, this is considered high prevalence. And in fact, the Philippines is one of the 10 countries in the world with the highest stunting rate. So to address this concern, the Philippine Multi-Sectoral Nutrition Project, I will call it PMNP from now on, is implemented and was launched in 2022. This is a government-led initiative to respond to the issue of childhood stunting through nutrition-specific, nutrition-sensitive, and social behavior change intervention package. So this is a 4-year project, and this is a full leadership by the Department of Health for the nutrition-specific interventions, and with the Department of Social Welfare and Development for the nutrition-sensitive interventions. And again, as mentioned by Xavier, this was supported with World Bank financing. So this is being implemented in 275 municipalities across Luzon, Visayas, and Mindanao. The municipalities were selected based on their level of stunting. Siyempre po, yung highest stunting rate in the country, sila pa yung napili with high poverty rates as well. and this includes farm municipalities. So now going back to the evaluation, so as I mentioned, we were commissioned by DOH to conduct evaluation of this big project. So the aim of the evaluation is basically to establish quantitatively the impact of the PMNP to key nutrition and health outcomes, which are known as key determinants in reducing stunting. These key nutrition outcomes includes these 5 major indicators. This is the minimum acceptable diet of children 6 to 23 months old, iron folic acid supplementation, antenatal care services for pregnant women, convergence of those priority nutrition-specific and nutrition-sensitive interventions in a household level, and of course, access to improved toilets for eligible households. All of these 5 major indicators are really being looked into just to see whether the project, as big as this, PMNP, has really had that impact to the nutrition outcomes. So, and of course, the second aim of the evaluation is to provide evidence-based recommendations to inform the improvement of this project while it is still ongoing, and at the same time inform the scalability of the project in the next years to come. So we will do baseline up to end line. So later I will discuss this more thoroughly. So in terms of evaluation design, the evaluation is applying mixed method approach, which is a quasi-experimental design. We also have treatment and control group in PMNP sites and non-PMNP sites. So comparing those sites from baseline to end line and see the difference between the two parts. So basically, we're using difference in difference with matching approach. So for the baseline data, the findings from the baseline, this is what I'm going to present to you today. So this was conducted in October last year, and it covered 3,000 households to generate the quantitative data across the 75 matched municipal pairs from PMNP and non-PMNP municipalities. So we sampled 75 municipalities among the 275 project areas, and another set of 75 municipalities in non-PMNP areas. So ensuring that those match pairs have the same profiles so that we can compare the results later. So with this quantitative data collection from these 3,000 households, we complemented it with qualitative insights across 6 municipalities, and we conducted 30 FGVs, discussions, and 30 EIRs. So now the baseline findings. So in terms of relevance and coherence of this PMNP project, this review shows that the PMNP is indeed a highly relevant project. It is perceived as highly relevant project by stakeholders. Basically, the DOH, the Department of Social Welfare and Development at all levels, national, region, barangay, region, province, municipality, and barangays. So it is perceived as highly relevant, particularly because of its focus on improving the early childhood care and development and water and sanitation hygiene infrastructure, and by providing grants mechanism for the implementation of local nutrition action plans at the municipal levels. So the project was also highly appreciated because it is applying multi-sectoral approach paired with capacity building among all the duty bearers, and with financial resources as well to strengthen service delivery at the local level. And also, it was based on the desk review, the PMNP is also well aligned with existing national government policies such as the first 1,000 days law, the PPAN or Philippine Action Plan on Nutrition, and the SWD strategy map, which is then helping the program goals of outlined in the policy. However, despite these positive findings, there are key findings as well on some concerns about how to properly harmonize all the PMNP components, as it is very important at the local levels because this is where convergence happens. And of course, there are also demonstration of service providers demonstrating prejudice or unfamiliarity in working with the most marginalized groups such as the IP population and people with disability. So in terms of the characteristics, findings from the households, the average household has about 6 members, mainly Catholic. 3% of the members are within the IP community, and 16% of them, of the households, are considered part of the 4P beneficiaries. So these households, majority of them own the cell phone. 91% of them own the cell phone, and but then only 47% of them own the television and 24% own the radio, which suggests that basically the samples are of higher level of poverty compared to the national average. And most households as well reported experiencing some level of food insecurity in the past 4 weeks, and 30% of them were categorized as less moderately food insecure. So in terms of the water, sanitation, and hygiene findings, 94% of them have access to an improved sanitation facility, but still 6% of them practice open defecation. In terms of maternal outcomes, these are from the mother respondents. Almost all the mothers in the sample receive at least some prenatal care, with 70% attending the first visit in the first semester. However, only 37% of them receive the WHO recommended 8 visits for antenatal care. So 90% as well of our mothers reported receiving iron folic acid supplementation, but then qualitative findings suggest that women did not consistently utilize the warming tablets. So because of no information or lack of information on the benefits of the warming, and less than 1/3 of our women attended postnatal services. So high antenatal care, but postnatal care is really very good. In terms of the knowledge of breastfeeding, there's also a high knowledge on breastfeeding for children. But then 90% of mothers also understood the health benefits of consuming fruits, vegetables, and iron-rich foods. But despite this good nutrition knowledge, only half of mothers in the sample satisfied the minimum diet diversity requirement. So makita po yung quality of diet. For the children, we have 3,000 children in the sample. Children show moderate use of health services, and most children follow vaccination schedules, although there are still considerable for improvements. 62% of them are exclusively breastfed. This is higher than the national average of 50%. Yes. In terms of the quality of dietary intake, the survey baseline shows that although the minimum meal frequency and energy intake is high, the quality of diet intake is very poor. So only 41% satisfied the minimum dietary diversity threshold, and 31% consumed the minimum acceptable diet. In terms of the anthropometrics, these are the measurements on looking into the nutrition status of kids. These are looking into the weights, heights, and walk of children. The samples, the findings show that 25% of our sample children are standing. So halos pareho po siya sa national average. Now, the recommendations. So, these are basically recommendations for the UH, DSWD at all levels. Hopefully, they will look into this when the PMNP project is being implemented. So first, PMNP could explore alternative ways to provide iron supplementation to pregnant women to address the issue of bad smell and unappealing to many women. So, sana po maayos yun. And then also to strengthen the supply of key inputs of vitamins and vaccinations in health centers, particularly in rural health areas. Madami pong stockouts in the rural areas. And also prioritize provision of postnatal support. Masyado mababa ang postnatal support. And also strengthen the capacity building activities for service providers to be able to provide appropriate and culturally sensitive services to marginalized groups such as the IPs and people with disability. And lastly, last slide, is to of course reinforce practice of deworming during pregnancy and also explore coordination and convergence with existing health services such as family planning, as are known as a great vehicle for improving reproductive health outcomes, and also continue to emphasize additional efforts towards achieving zero defecation or modification. Kagaya ng kanila, 6% pa po ng households are practicing open defecation. And also support activities that bring pregnant women and mothers together to share knowledge and experiences related to pregnancy, IYCF, and childbearing. And lastly, considering that 91% of households own cell phones, prioritize program-related messaging through the cell phones. So, I think that's it for my presentation. Thank you so much.
Thank you very much, Bing. Stay on the stage. So another interesting presentation. I've been involved in that one, and one of the interesting things methodologically for the researcher here is in the nudges there was a use of randomized controlled trial. And it's not, we're talking about an impact evaluation, but it didn't use randomized controlled trial. Why? Because actually DOH had already picked up the site, so we couldn't randomize them. That's why we had to look for another methodology, and we're using reference indifference to do that. There's still the choice of, as you saw, intervention sites and control sites. And so the baseline here is very crucial to really be able to compare those and to compare the situation. We want them to be as similar as possible to be able to show that the impact of intervention so the impact that the interventions have an impact on stunting ultimately, but on the site. So we have Nikki and Bing, and I'd like to open it for questions on these two important presentations. Yes, Steven.
Should I go?
Yeah, you close.
Okay.
Take this one, and I have another one.
Thanks. I have questions for both of you, actually. So for PMNP, I have two questions. The first is on timeline. So I saw the project started in 2022, but the baseline was conducted in 2024. So I was just a bit confused on if the data collection for this baseline has already happened after significant exposure to PMNP activities and just where that falls. The second question is just what's happening with the results and how they might be shared back to PMNP implementers, or what's coming of the data now. For Nikki, the question I wanted to ask is, on most of the graphs that you showed, the biggest point of where learning plateaued was between grades 2 and 3, which is also coincidentally when the period where students were going back to school. So I'm just curious about what your inferences to that are. I think I would initially assume that if they're going back to school, it would mean that you would actually see learning increase again. But maybe the opposite is true, where the learning outcomes from previous years, the learning losses from previous years have kind of compounded, and maybe teachers, now that they're back in school, are struggling to figure out who's doing where and how to make sense of helping their students get back on track. Thanks.
Okay, thank you. For the timelines, that's a great point actually. So the PMNP was launched in 2022. The social preparation takes time to be completed because this involves municipal level, 275. So the project ensured that the barangay, the municipal mayors accepted the project. So meaning up to 2023, no major interventions were completed, and so implementation just started early 2024. So that's why the impact evaluation baseline was conducted in 2024. And in terms of what's happening now to the results, we are really bringing this back to the implementers, the DOH and the SWD at all levels, so that they would be able to influence their annual work planning to include all of these recommendations, hopefully, so that hopefully by the end of the project, some positive results will come out.
Thank you, Stephen. Very interesting. Part of the reason is our inference is that in kindergarten, we advocate for the play-based approach. So lessons are not so strict. Socialization is the focus. This carries over somehow to grade 1 because some of the grade 1 teachers, they recognize that even if the kids finished kindergarten already, they're still not yet ready for the grade 1 level. So they are a bit more lenient in terms of, especially now with the new policy. DepEd is now accepting kids as young as 4.5 years old in kindergarten. So grade 1 teachers have some understanding that they don't need to be so difficult in terms of the lessons. But grades 2 and 3, that's where really the academic side really comes in. Even in grade 3, that's where science comes in. So and it's delivered by the same teacher. So the perspective of a grade 2 teacher is very different from perspective of the grade 1 teacher. So the short answer is that we're a bit more strict starting grade 2 and grade 3, and the competencies start to become a little bit more complex regarding that one. If they were just learning the same competencies in grade 1, then the trajectory would be a straight line. They would have learned it at some point. But we were also changing, or we are improving the complexity of the curriculum. So some drop is really expected. Thank you.
Thank you, Nikki and Ray. Any other questions? Yes. You have a microphone right in the front. Yeah. And then see, do you want to go to there's a microphone right there. Go ahead, sir. Or you can come here. I can give you. Here you go.
Good afternoon. I am Keo from Ateneo de Manila University. I would like to direct my question to our esteemed first presenter. Thank you for sharing your research. The data appears to come from a highly credible study, particularly given its longitudinal design involving approximately 3,000 children. I am particularly interested in learning more about the catch-up programs you have implemented before students complete grade school or grade 6. Could you please describe the interventions you have done and which of these practices you believe could be realistically adopted within the public basic education sector? Thank you.
Thank you. So, a few options. Number one, so you can imagine when people came back from pandemic, people were not ready, di ba? So they were trying to find out what to do best. Ganyan. So there are different modalities in terms of what do we do to recover learning. One method was to do the 8-week program. At the beginning of the school year, you don't go into the curriculum yet. For the first 2 months, you just focus on foundational skills. Reading, writing, and then counting, I guess. Depends on the level, no? But the idea is, for the first 8 weeks, you focus on the foundational skills before you go into the details of the curriculum after the second month, no? So that's one. The other thing is that you will notice what DepEd did in terms of the National Learning Camp, the Catch-Up Fridays, things like this. The idea here was really to give another environment for the learners so that they can experience learning in a different way. So identifying the ones who really needed help and then giving them a new, non-threatening environment for them to catch up without really labeling them as the ones being left behind. So that's another one. And then the third one would be what we call the pull-out method. Well, let's go to the after-school method first. So after school, there are some programs that they do with some of the kids. But again, this is similar to the learning camp. This is similar to the Catch-Up Fridays. It's non-threatening. You just group them according to competencies, but you don't call them the advanced group, the behind group. You don't call them like that. You give them colors, you give them animals, ganyan, you group them into different groups. You do that after school. And then lastly would be the pull-out method. The pull-out method is really like not really the gold standard, but it gives you focused attention on the ones who really need support. So it's a bit difficult for the public school sector to do this because they would need qualified people to take the kids out of the class and then really conduct separate sessions with them. So we're modeling a few of these interventions so that we can find a way to make it a bit more affordable and practical for the resources for the public school sector. So there are quite a number of models, but the most important is to teach your best during the actual classroom session. And the secret there is what I mentioned earlier, Carl, teaching at the right level. You don't even need the after-school program. You don't even need the 8-week curriculum, but it requires a different way of teaching your regular 7 to 3 or 8 to 5 classroom sessions to make sure that you're teaching at the right level. So quite a number of models to choose from. Thank you.
Good afternoon, everyone. I am Marvin Dominic Abindanyo from Holy Cross of Davao College. My question is for the first presenter, Mr. Nicolas. I'm from the Education Department, and what I'm seeing actually, particularly in places such as learning institutions that are erected in geographically isolated in disadvantaged areas, far-flung learning institutions, as well as public schools in rural areas, they already have implemented Catch-Up Fridays, National Learning Camp, which are, I think, these programs are part of the project Aral of the Department of Education. However, what I have seen on the ground is that they are implementing it by paper, wherein they have reports, but there is no like actual implementation wherein learners are being provided with such intervention. And the main rationale behind why we have these programs is that for us to really help them recover and achieve developmentally appropriate competency for them that is deserving for them really to achieve. Question for Project Aral. Are there mechanisms that are being established to make sure that this project will be really implemented and we will be able to really achieve the thrust of Project Aral? Because I believe the real issue here is the systemic crisis that we are having, particularly in implementing such program in our country. Are we really implementing it just for mere compliance or really for every Filipino learners? Thank you very much.
Thank you, sir. So just to clarify, the National Learning Camp and the Catch-Up Fridays, for example, they were not yet part of the ARAM program. The ARAL program hasn't existed when it was being implemented. So as I told you, the Department of Education was experimenting with different projects and programs to find out what's the best way to recover learning. But now the ARAL program, the number one consideration is that it's a national law. That's number one. The others were just department orders or agency initiatives. This one is a national law. Number two, they're talking about it now in terms of budget allocation. And then number three, for example, we're trying to make sure that the ARAL program has learned from previous experience and has reduced yung unintended consequence. So for example, you can only be a tutor if you're a deputy teacher, if you're teaching, if you're gonna tutor the ones that are not in your regular class. So for example, it's not the same person that you're teaching from 7 to 3, and then in the afternoon you will still meet him or her. So that defeats the purpose, no? So you can only be a tutor for people that are not in your regular class. So a lot of the learnings, so what other findings from the National Learning Camp? It was made voluntary. So what happened was, you can imagine, if you did not identify the children who needed help, the people who came during summer were the kids already high-performing. So there's selection bias in the targets, no? So that's being understood now with the ARAL program, so that you already target or you serve the kids that you really need to serve. And then lastly, at some point, they have plans to really do the pull-out system. And then there are also models for the teaching at the right level. So we understand that there's a lot of challenges, but all of them are operational issues. At the very least, our concept is safe and sound. I mean, it's really academically sound. And then we can just worry about the implementation now, because we're getting the budget, we're getting political support, and we're getting like societal interest also in the ARAL program. Thank you.
Thank you for this question, and thank you for the presenters. That's all the time. Oh, you have one more question, a quick one, because I think for colleagues.
I'd like to address a question to ma'am pertaining to malnutrition. I'd like to know what information campaigns have you started or have used to be able to increase knowledge and hopefully change the behavior of the mothers?
So part of the PMNP intervention package is social behavior change. So all the LGUs, 275, were trained on how to develop a social behavior change plan, one-year plan, and that is funded as well by the project, by the PMNP, through UNICEF. So we train them we train them on how to implement those SBC behavior change activities. So, yeah.
May I follow up? I'd like to ask for specific communication materials that were used. If I may follow up, please.
Yeah.
Very quickly, yeah. I'm very curious because you said there was a plan. I wanted more specific cases of communication materials that were used to increase awareness and change behavior.
Yes, so part of the plan is actually a national SBC strategy wherein the 5 key behaviors to be targeted are identified. So specific materials were developed for that, basically for improving sanitation, ENC, the 5 areas that I mentioned. There are specific materials developed for that and are already available and being shown in the health facilities at the municipal and barangay level. So maybe we can share copies of that, ma'am, and then the link. Yeah.
Thank you.
Thank you very much for all the questions. Just wanted to emphasize that my colleagues and our partners are here until the end of the day, so please take that opportunity. They are engaged into research, but in policy making, don't go away, Nikki, you have to stay. I'd like to invite our colleague back on the stage for a photo, and thank you very much to everyone.